Welcome to another episode of American Drug Talk, sponsored by Accredited Drug Testing, the nation's leading provider of drug, alcohol, and DNA testing. Now here's your host, the president of Accredited Drug Testing, Jim Greer.
Welcome to another episode of American Drug Talk. I'm Jim Greer, your host. Today we're coming from the beautiful Shingle Creek Resort in Orlando, Florida, where the National Drug and Alcohol Testing Industry Association is holding their conference. We're honored today to have the incoming chairman of the Drug and Alcohol Testing Industry Association, Ms. Jo McGuire. Jo, welcome.
Thank you,
Glad
Jim.
to have you here today.
So happy to be here.
The conference is going well.
Yes, it is. We're going to have an exciting year.
A lot of people, I understand about 700-800 people come here.
Yes, it's exciting.
Is this year bigger, do you think, or?
I think it is. I think it is this year, and I think it's because there are some crucial things impacting drug and alcohol testing industry, and it's important for us to learn about best practices.
Mm-hmm. Now I understand that there's going to be speakers from the government here, along with laboratories, a lot of educational seminars too.
Correct.
A lot of things like that.
Always
Are you speaking?
exciting. I am speaking. I'm co-presenting with a colleague from Colorado named Chuck Marting, and we're talking about the marijuana bully in the workplace and how employers can handle that. It's going to be fascinating.
Well, we're going to talk about that in a minute, but you're the president of a company called 5 Minutes of Courage.
Yes,
Is
I
that
am.
correct?
Yes.
Can you tell me what is 5 Minutes of Courage and what you do?
Absolutely. I was in the drug and alcohol testing industry, which I just love. I love compliance and all of those things. And we started seeing, I live in Colorado Springs, and we started seeing a huge increase in positive drug tests, especially amongst our young people, when Colorado passed marijuana for recreational use.
How long ago was that? When was it?
We passed it in November of 2012, and in January of 2013, it became legal, and then the retail market opened up in January of 2014.
Where they started selling marijuana.
Right. But the positive drug test went up within a few weeks. It was incredible. And I just started telling that story. I just started saying that this is what is happening and we need to pay attention to it. And so there became a demand for, oh my gosh, come and tell us what's going on, and what do we do? How do we handle that? How is it impacting the workplace? And what are best practices? And after coming and bringing that message to DATIA to say to my colleagues, this is what we need to be prepared for, I ended up going out and doing 5 Minutes of Courage. And I called it that because as I went out and talked to people, what I'm saying is not the popular, what culture wants to hear right now. It's going against the grain. But I believe if we take 5 minutes to speak the truth, we can create the change and remind people of common sense practices that literally save lives. So I've been doing that in conjunction with doing special projects for TSS Inc., which is a drug testing company and TPA out of Alaska. And it's been a beautiful marriage because I get to keep my roots in drug testing in the day-to-day. And then I also get to go out and continue this education, and we do some really fun and interesting things together.
So the idea for 5 Minutes of Courage is that people will just step back for 5 minutes and listen to these important issues, particularly on marijuana. They may come to a different conclusion.
Absolutely.
Is that correct? Now you have a personal story. I know you're very passionate about this. Can you tell us, if you don't mind, your personal story as it relates to this issue?
Sure. For many years I was in drug education prevention, risk prevention education for youth and young people in my state. And my children, I have 3 children, and they were used to mom coming into their school and talking about all kinds of risk prevention programs. And then I moved into drug and alcohol testing from there. And after I was learning and growing in this business, one morning my oldest son came and said, "Mom, you need to come downstairs. Jordan just tried to hang himself." And this was a shock. This was my middle son. He was 17 at the time. He was a high achieving student, musically gifted, just the brightest, smartest, funniest guy, and kind of like the glue of our family in many ways. And he went downstairs, and there he had deep ligature marks in his neck from where he had hung himself in the closet with a belt, and his brother had just literally saved his life. And we go to, mental health intake, and we're sitting there waiting to find out what they can do to get him a room, get him a bed, and the social worker asks to interview me, and we go into her office, and she says, "Mrs. McGuire, we need to speak about your son's marijuana use." And I said, "Oh, my son does not use marijuana." And she said, "Well, according to him, he's using quite a bit." And I said, "He's lying to you."
And you had no idea?
No idea. I never expected. And I was the PTA mom. I was the youth group volunteer. I did all those things. Went on the field trips and all of those things. He was in marching band. We're doing all these wonderful things, and it was just an absolute shock. It was a wake-up call, but it was just an utter shock. And I had known something was not right, but going to the doctor, going to the pediatrician.
You never suspected drug use?
Well, even our physician didn't, because they knew our family, And so we never did a drug test, never thought of it. And that began a couple of years of just in and out of treatment, running away, another suicide attempt, mental health, drug treatment, inpatient, outpatient. Miserable time that really consumed us and defined us for several years. And finally it culminated in, this talented, amazing kid hit the streets and became a straight person. And he's pulled himself out of the homeless situation now, but sobriety and addiction and all of those things are a daily issue. And it has been amazing that I could be so close and yet so far away, right within my own home.
Do you think, Joe, that the start of that might in fact been the beginning of using drugs, marijuana? Do you believe that the use of marijuana, to the point that you said they said he was using, had a direct impact on his life and what happened?
Marijuana, cannabis, pot, however you're going to define that, was his drug of choice, still is to this day. I mean, he will say, "Guess what, Mom, I'm clean and sober." And I've learned that before I get too excited, I say, "Well, what does that mean?" And what it means is I'm only smoking pot every day. So that's been a constant. Other drugs have come and gone, alcohol has come and gone, in and out of the picture, depending on what's happening, but pot is his world, it's his life.
Well, certainly because of this unfortunate episode in your life or situation, you not only are passionate about what you do, you can bring some real life scenarios to the table.
Correct.
When you talk to people, a lot of people can't do that.
Right.
They can talk about a subject from an academic standpoint, but you've actually lived it.
Right.
So.
Because the overarching, permeating message right now is that pot is safe, it's harmless. It's just like a little wine with dinner, and people really do not understand that the pot we have today it's not just a little weed. It's not like Woodstock weed or the pot of the 60s and 70s. We're talking about a substance that has evolved and has become hyper potent. It's now manufactured, it's chemically altered. We've changed it to these derivative products. It's chemically enhanced. It's more on par with crack and or even meth, and we're letting it go because there's this pressure.
It's a cultural issue.
It's a cultural pressure.
Acceptance.
Yeah. To go, it's just inane, and that's not the case. That's not what is being brought to us, but we're welcoming it with open arms because he wants to be that guy.
Well, let me ask you, from the perspective of states that are passing medical marijuana laws, as they're called, some of them are passing recreational use, but a large percentage, I think 24, I'm not sure exactly the number, but maybe 24 states now have medical marijuana usage, Florida being one of them, where we're coming from today. What is your opinion of that, and what do you think that the impact that that's going to have on communities, but also employers that may be a drug-free workplace?
Right. Regardless of how anyone feels about this personally, the issue of medical marijuana and how this is passing in states and being considered a states' rights issue, it's really a fascinating shift in American government and in politics and policy, and that you literally have a very well-funded policy organization who wants to profit off of this substance. They have created a long-term plan to do so, and they go in and wheelchair in people with oxygen tubes and say, this woman died of cancer, needs her medical marijuana, and she shouldn't be on opiates, or this child who has seizures and can't stop seizing, and breaking hearts, of your policymakers. The only thing that will help them is medical marijuana, when in reality, the percentage in Colorado for medical marijuana, and California is the same, there's only 2% of the entire medical marijuana registry that is actually cancer patients. In the state of Colorado, we have less than 30 children who are actually qualified to try marijuana derivative products for their seizure disorders. This isn't thousands and thousands, and in fact, there are many people where these things are ineffective. Now, none of us would want to take someone who's in end of life stage cancer suffering and say, hey, if they want this for pain, I think every one of us are going to say, you have weeks, left, whatever will help. But that's not what we're seeing. What we're seeing is the lawmakers feel pressured and they have these emotional scenarios. They change the laws based on a few, and then in Colorado,
The loudest.
yes,
A lot of times the loudest.
the loudest, and then in Colorado you have thousands and thousands, a few 100,000 people on the medical marijuana registry. The average age is a 38 to 44-year-old working male who has a history of drug addiction. That's your number one medical marijuana patient. I say marijuana for medical excuse is how I say it. But what are they doing? They're saying, well, I was skiing and I wrenched my back, or I hurt my knee, or now I have tendonitis or whatever. I gotta smoke my pot every day. Yet Colorado continues to be in the top 3 healthiest states in the U.S., but one of the number 1 for medical marijuana use amongst healthy working adults. The second age bracket is college students. So, in my opinion, it is a farce that's being foisted on the American people for some elite few that are profiting.
And it is big business.
It's big
these
business, it's
dispensaries that are
big
opening
dollars.
up. I mean,
Yeah.
here in Florida, we're seeing lobbyists being hired. Some of the top lobbyists, well-known in the Capitol, are being hired to represent
Right.
growers of marijuana and potential dispensaries. And,
Oh, yeah.
And there was an effort this last legislative session to expand the number of dispensaries in Florida. And I'm sure that's what happens everywhere.
That's the pattern. First you get limited use, and then the next step is expanding use because patients can't get access.
I see.
And so then you expand use. So we went in Colorado from a caregiver could have 3 patients, and then they could have 10 patients, and then they could have unlimited patients. Now you can have commercial grow facilities that are just growing patients' product for them, and so then it just, there's some states, the state of Oregon, when they implemented medical marijuana years ago, they never even had a tracking system of who opened a dispensary. So when they layered recreational marijuana on top of that, they don't even know how many facilities or operations they have in the entire state to start out with. Now they're supposed to regulate it and keep track of it, but it's already out of control. That's why Oregon isn't the one featured on 60 Minutes constantly, it's Colorado. But if you want to think that Colorado's doing it any better, let me tell you, there are plenty of loopholes and gaps and problems and inability to regulate. But just as you said, you have an interested party who's pocketing the big dollars. Just think, the way we need to think about this and understand it, we are watching the reemergence of Big Tobacco 2.0. We already know what happened with R.J. Reynolds and all of those companies. We know that history. We look at that and go, that was terrible. But we are party to doing it all over again, not having learned lessons. And we are going to be culpable for that in the future and when it comes to our children and their health and well-being.
Now let me ask you, isn't marijuana still a Schedule I drug under federal law, same as cocaine?
Absolutely. Just in this past year, 2016, In August of 2016, the Department of Justice reissued marijuana on the Schedule I list, and there's a beautiful report. The DEA was involved, SAMHSA was involved, 6 government organizations, because the White House said, let's reinvestigate this and see if we can reschedule or deschedule. So there was a lengthy investigation. The medical science was taken into account, and marijuana, cannabis, meets all of the criteria for Schedule I. There's no dosing amounts, there's no prescriptive amounts, there's no reasonable medical use. It's not a healative agent. There are some possibilities in cannabis, some properties such as CBD, where if we could do a pharmaceutical grade copy, we could see there's some FDA trials happening right now with GW Pharmaceuticals that are showing promise. Many have failed those tests. But raw cannabis has no medical value, and that has been repeatedly proven. And yet, but see, medical marijuana is not a term coined by the American Medical Association, who has come out against medical marijuana, the American Pediatrics Association. There's dozens of medical associations that have said this is not helpful. And yet, the people who want to make the money coined the term medical marijuana. And so there's all this confusion. And so let's go to workplace. Employers think, my employee comes in, they have a medical marijuana card. Oh my gosh, that's HIPAA, that's a prescription. I have to step back, I have to let them do it. I have to remove THC from my drug panel. Oh my goodness, no, I have a patient, what do I do? And I hear them all the time say, well, I have a patient that works for me, so what do I do? They're not patients. This is not a valid prescription. It's a permission to possess without prosecution, as long as you're within the boundary of how many ounces. A physician cannot prescribe, they cannot dose. So in states that have medical marijuana, participating physicians, which are usually not practicing other types of medicine, they're dedicated. They go with no medical history, no records, no other tests. You want to try marijuana for your, tricky elbow or whatever. Okay, you can try it if you want. I'll sign my name. You can possess it. And then that individual goes to a store or a provider, and usually if they're an inexperienced user, the retail owner says, why don't you smoke a bowl of this or eat some of these gummy bears, or so you can't prescribe it. There's no dosing. There's also no contraindicators. What if this person is on heart medication? Did you know that marijuana use increases risk of heart attack and heart failure?
So there's other negative effects.
Right.
You may be taking it thinking you're solving one medical issue, but it could be causing you additional.
You could be complicating. So we have no contraindicator indications, anything like that. So here you have people who are saying, you can't do anything about this, I have my card. And the card means nothing. The card means, I just admitted to you I smoke pot. That's what it means.
Awesome.
So employers are very intimidated, they step back, and what they need to say is, this is an impairing substance. You don't go to work drunk. You don't go to work so under the influence of a prescription medication you can't function. You also don't get to come to work high. And keep the boundary, keep safe and drug-free workplace at the forefront. That is the priority, not employee drug use. The right of an employee to use drugs in the workplace is not our priority.
Right.
Our priority is keeping people safe so they can come home at the end of the day to their family whole. And when we start making the drug use the priority, we have everything turned upside down and backwards.
So employers are not required to accommodate an employee who has a medical card for marijuana,
Right.
or even in a state that is recreational. If an employer wants to be a drug-free workplace,
Yes.
they can prohibit employees from using marijuana or any other illegal drug.
Absolutely.
And that's the way it is across the country?
It is absolutely that way across the country. There are 11 states now that have written some type of protection for employees who use medical marijuana, which typically means, so far, you cannot discriminate against them. Well, what does that mean? You can't treat them like anybody else. What does that mean? You enforce your policy for this person, you enforce your policy for that person. You enforce your policies across the board, equally, the same for everyone. Nobody gets special treatment. That's the definition of non-discrimination.
Well, I appreciate you telling us, what's really going on out there across the country, because there are so many misconceptions about marijuana, medical marijuana, what employers can do and what they can't do. But let me ask you, let's turn for a moment. You're the incoming chairman of the Drug and Alcohol Testing Industry Association, and I happen to have the privilege of serving on the board of directors with you. Let's take a moment to talk about what you want to do as the incoming chairman. Any goals and objectives that you have that you'd like to see DATIA, which is the nation's leading representative of the drug testing industry. Have you some thoughts as the incoming chairman of what you'd like to see happen with DATIA and what DATIA can do to educate people around the country?
I absolutely do. This is a crucial time for employers' rights to a safe and drug-free workplace and the right of employees to work safe and drug-free and not be put in harm's way by an employee who makes a different choice. And the drug and alcohol testing industry is specifically under attack by groups that are promoting legalization, such as NORML, the Marijuana Policy Project, the Drug Policy Alliance. They're saying workplace drug testing isn't fair, it isn't fair. And
so they'd like to do away with workplace
They are
drug
trying.
testing.
They're trying. They put forth an initiative in Oregon, Senate Bill 301, to say marijuana is legal in Oregon. Now you should not be allowed to drug test for marijuana. And it went up in smoke last week, no pun intended. It failed because common sense prevailed. This is contrary to national safe and drug-free workplace rights. And so our industry, right now, the marijuana industry, as they call themselves, they're running the dialogue, they're running the conversation, and they're putting out misinformation, misdirection, and they're telling people things about drug testing that are completely false, untrue. And we need to get in there. We need to be the voices, the experts, DATIA. We need to drive the conversation. We need to educate employers and groups, HR groups and professional organizations about how drug testing really works, about the success rates of drug and alcohol testing, about the prevention efforts, about helping people change their lifestyle choices to focus on health, wellness, safety, productivity, things that we all want to see for ourselves, our companies, our coworkers, and those that are our friends in our communities, our families, because we know drug use impacts families, children. So it's a big vision, it's a big goal, but we need to change the conversation back to truth and fact and reality, instead of allowing this, what I personally call the party culture, where you can light up a joint on national TV and we all celebrate that. What are we doing here? Our kids are watching.
So you want to change the discussion. To be factual.
Right.
So that they can't showboat the issue with things that aren't necessarily true to get sympathies from people.
Right.
But you'd like to see the Drug Testing Association become a strong advocate.
That's right.
For those issues, be out front more.
Right.
And
when you have the marijuana industry saying you shouldn't be able to drug test people because they can go to Colorado, smoke once on vacation, and test positive for I've heard 6 months to a year. It's a complete falsehood. It's a straight up lie. And as the experts in this industry, all of DATIA members, we need to be able to say, hold up a second. You're not going to get away with that. That's not how that works. We need to empower employers to hold on to their drug and alcohol testing policies for workplace safety, and be the go-to to say, no, here's the truth, here's the facts, and reinforce them and help support them.
Well, Joe, I think DATIA is very lucky to have you as the incoming chairman. I think you're going to do an outstanding job. I'm glad to hear your goals and objectives, because I agree that's what DATIA should be doing. We should be out there advocating, leading about all issues relating to drug and alcohol and protecting employers' rights. But most importantly, I want to thank you for being here today on American Drug Talk. I hope you have a great conference, and I look forward to hearing you speak tomorrow. I'll be in the audience.
Thank you very much.
Thank you, absolutely. And thank you for tuning in to another episode of American Drug Talk from the beautiful Shingle Creek Resort here in Orlando, Florida, where the National Drug and Alcohol Testing Industry is holding their conference. I'm Jim Greer, your host, and I look forward to seeing you next week on another episode of American Drug Talk.